Hi everyone, welcome back to Tomography Series 1. In this video, we will discuss about CT Scan PNS Limited. In this, I will include all the key factors like indication, patient preparation, patient positioning and instruction, scan parameters, filming, PACS and archive system, CD and DVD, radiation safety and protection. So let's get in.
Indication: to rule out sinusitis, evaluate sinuses that are filled with fluid or thickened sinus membranes. Detect the presence of inflammatory disease. Provide additional information about tumors of the nasal cavity and sinuses. Plan for surgery by defining anatomy.
Patient preparation, NBM status not required. Female patient with childbearing age, please ensure LMP and confirm non-pregnant status. Remove metal object including jewelry, eyeglasses, nose ring and hairpins. Remove hearing aids and remove dentures. Take special care with details from elderly, handicapped, deaf, blind, very young, individuals with poor language problem, etc. Patient positioning and instruction. Positioning, orientation, head first supine into the gantry with the head in the head holder whenever possible. Patient should be straight, chin should be down in flex position. Center the table height such that the external auditory meatus EAM is at the center of the gantry. Instruction: before starting the scan, explain whole procedure to the patient so they can understand what they has to do during the scan. Patient head should be stable, so ask the patient to do not move head during the scan. Scan parameters: topogram, AP and lateral. Coverage from frontal sinus to maxillary sinus, KV 120, MS 140, collimation 0.6 mm, slice thickness 3 mm, slice interval 3 mm, pitch 0.8, rotation time 0.5 seconds, scan mode helical, scan direction craniocaudal, scan delay 2 seconds. Recons: Recon 1 3 by 3 mm axial soft, Recon 2 1 by 0.5 mm axial soft for 3D, Recon 3 3 by 3 mm axial bone, Recon 4 1 by 0.5 mm axial bone for 3D, image kernel H30 medium smooth for soft tissue, H60 sharp for bone. Image window sinuses for soft and bone. Filming: Film 1 plan view, coronal soft, slice interval 3 by 3 mm, window level soft, film format 5 into 7 35 images. Film 2 plan view, coronal bone, slice interval 3 by 3 mm, window level bone, film format 5 into 7 35 images. Data for PACS and archive: 3 by 3 mm axial soft, 1 by 0.5 mm axial soft thin, 3 by 3 mm axial bone, 1 by 0.5 mm axial bone thin, 3 by 3 mm coronal soft, 3 by 3 mm coronal bone, and patient protocol. Data for CD and DVD. You can give thick data in CD like 3 by 3 mm axial soft, 3 by 3 mm axial bone, 3 by 3 mm coronal soft, 3 by 3 mm coronal bone, and patient protocol. In DVD, you can give thick and thin data like 3 by 3 mm axial soft, 3 by 3 mm axial bone, 3 by 3 mm coronal soft, 3 by 3 mm coronal bone, 1 by 0.5 mm axial soft thin, 1 by 0.5 mm axial bone thin, and patient protocol. Radiation safety and protection. Always follow ALARA principle as low as reasonably achievable. Avoid repeat scan. Always check pregnancy status in female patient. If needed, take a consent. Always use radiation protection accessories like lead apron, thyroid shield, conal shield, etc. It is ideal to use two lead aprons front and back of the patient for radiation protection. Strictly follow radiation safety protocol, especially in pediatric patients. Hey guys, that's all for this protocol. Please do subscribe our channel and share this video with your radiographer friends.